my name is Lucy and I'm a student paramedic and I'm here to do an assessment onto you today. So could I get you to tell me your name and date of birth, please?
My name is Bianca Cox-Lofter and I was born on the 14th of July 1996.
Awesome. So what I'm going to be doing today is I'm going to be doing a cardiovascular assessment on you today. So I'll be going from looking at you to looking at your hands, looking at your face, just feeling around your chest as well as just a few areas of your stomach. Is that alright with you?
Yeah.
So just before we start, are you in any pain or short of breath or anything like that? No? Okay, so just looking around your bed, I don't see any extra pillows, which could suggest that you may have congestive heart failure. And are you on any medications?
No.
Okay, so I don't see any medications around your bed either. Are you comfortable where you are right now?
Yeah.
So you're in a nice 45-degree angle that we have here, and just to conserve you, I'm just going to work around your top, and when I need to, just go under your top to listen to your heart and things like that. Is that alright? Okay, so just looking at you, you don't seem to be flushed at all, which could suggest some mitral stenosis. I'm just going to take a quick look at your chest to see if there's any scarring, as there could be a internal defibrillator placed up here, and any scars down the middle could suggest some sort of heart surgery has gone on. I'm also just going to quickly check for peripheral edema or pitting edema on the legs down here. Move my fingers and they come up quite nicely, and pitting edema just suggests on the peripheries that you might have right-sided heart failure, which you don't. So I'm also just making sure that you've got all your toes, no limbs are missing or anything like that. No? Awesome. So just moving on, could you please put your hands face down for me? So I'm just looking for any splinter hemorrhages, so there's any red or brown streaks on your hands, which could suggest bacterial endocarditis. I'm just checking the colour, which is well perfused, so you don't seem to be hypoxic at all. The temperature is nice and warm, and if it was a bit colder, I'd be a bit worried about poor cardiac output or hypovolemia. And they don't seem to be sweaty or clammy, which could suggest some sort of acute coronary syndrome. Now I'm just going to quickly check your capillary refill too, making sure that returns under 2 seconds. If not, we could suggest that it might be something to do with hypovolemia. So I'll just get you to rotate your hands outwards. Okay, so I'm just looking for any ulcerous nodes first, which could suggest infectious endocarditis. I'm also looking for Janeway lesions, which could suggest bacterial endocarditis. Now finally, can I get you to put your fingers together for me like this? Okay, so I can see a nice little diamond in between your fingers, which shows that your fingers aren't clubbed. But if it was, it could be caused by infective endocarditis or cyanotic congenital. So what I'm going to do now, Bianca, is I'm just going to check your pulse. So I'm just going to check your radial pulse first, just on this arm. Okay, I'm just going to check on both arms here. If there was a delay in either side of your pulses, it could suggest some sort of aortic coarctation. I'm also just going to raise your arm. You don't have any shoulder pain at all, do you? Okay. So I'm just going to raise your arm and look for or feeling for any tapping of the pulse, and if not, this could suggest some sort of aortic regurgitation. So I'm now just going to quickly take your blood pressure to determine whether you're hypotensive, normotensive, or hypertensive. So I'll get you to hold that for me. Thank you. So just stay nice and relaxed whilst I just pump this up, and it's just going to get a little bit tight around your arm. So your blood pressure was 110/68, which is very normal. So what I'm going to do now, Bianca, is I'm just going to be auscultating your carotids. So I'll just be listening to that and then find a place to start from there. Alright, so I found it there. Okay, so I'm just feeling on both sides of the carotid. And then can I get you to face to me? And I'll check on this side too. That all feels normal. Okay, So what I'm going to do now, Bianca, is if I could get you to look to the left hand side again, just noting it to see if there's any jugular venous distension there. I'm also going to just find the carotid pulse again on this side. I'm just going to apply a bit of pressure to this, the right upper quadrant of your abdominal region here, okay? So I'm just checking the hepatojugular reflux is no longer than 1 to 2 cycles. So I'll just feel it. If this were to take more than a few cycles, this could indicate some sort of heart failure or tricuspid regurgitation. Okay, so now I'm just going to take a quick look at your eyes, checking for conjunctival pallor, which could suggest anemia. Also just looking at the corneal arctus in your eyes, which could indicate hypercholesterolemia, which you don't seem to have. Looking at your mouth, you don't seem to be cyanosed. Can I get you to put your tongue at the roof of your mouth for me, please? So there isn't any central cyanosis there. If you just pop your tongue down now, I'm just looking for any inflammation around the outer edges of your jaw, which could suggest an iron deficiency. I'm also just looking at your dental hygiene as well, and that all seems to be good, but if not, it could cause infective endocarditis also, okay? So what I'm going to do now, Bianca, is I'm just going to listen to different parts of your heart. Also just listen to the bases of your lungs on both the front side and back side. Also just feeling around the bottom of your back there, as well as getting you to move into a couple of different positions for me, okay? So I'm just going to start by listening to the aortic valve, which sounds normal. Listening to the pulmonary valve, that all sounds normal. I'm just going to go up your top now, Bianca, and listen to the tricuspid valve, and also listening to the mitral valve. That all sounds very normal. So now I'm just going to check it with the smaller side of my stethoscope, okay? Okay, that all sounds normal. I'm just going to stay down here a second, Bianca. And can I get you to roll onto your left side for me?
Okay.
Okay. And could I now, just going to move my positioning, could I now get you to just lean forward to me? Awesome, so that sounds normal. So I'm just going to check the base of your lungs now, okay? Listening for any crackles which could suggest pulmonary edema. Make a nice deep breath in for me. On the other side. Now I'll just be going on to the back. Nice deep breath in and out. Also, whilst I'm here, I'm just looking for any sacral edema which could suggest right-sided heart failure, and the pulmonary edema in the lungs could suggest some left ventricular heart failure, okay? This now concludes my assessment. I believe my patient is low acuity on the scale. She's not short of breath, she's not in any pain. I haven't found any abnormalities on this assessment. I could further this assessment by doing a 3-lead or 12-lead ECG, could take her temperature and also do a blood glucose level, but I do not have those resources with me. I could also do a more thorough peripheral examination of the body, as well as getting her to go to a doctor's and get a blood test or urinary test done. Thank you very much, Bianca.